So here's another view, just as going in without checking into anything. This is from here. So see, I'm trying to do these e-check-ins for my mammogram and for my endocrinology. But if I try to do any e-check-ins, they're fucking around with my file. See? So they're in my account. Or once I logged in, it created some type of retaliatory error in my files. That's who these people are, and that's the retaliation that they're doing, because they got caught with billing fraud, and they were questioned on using advanced beneficiary notice for non-pay. It's a disclosure that says if basically your insurance doesn't cover, you're responsible, and they've been using this ABN form on me, and they're not supposed to, because they already know that it's covered by the insurance. So there are some criterias that Medicare has when they present that form, and the strike-through is never supposed to be used in reality because they already know it's covered. So they're committing mass document fraud in the billing department at this place. So this part goes on to legal documentation, and it goes on to YouTube. But the most important thing about these people is the ABN form that they're using, and based on the criteria that came from Health and Human Services, that form is not supposed to be used, and they're not supposed to be presenting it to anyone on this peninsula that goes through Montage if it's over a certain period of time, and they know it because they can see it. So like if you're coming in and they only cover something every 90 days, Medicare, and you came in 180 days or 300 days later, then they already know that it is after that time frame, so they're not supposed to be giving that advanced beneficiary notice. The strike-through is not supposed to be used, but they think they can. So I got another document showing that they used it again, and they actually are committing violations of the policies through the health, based on the Health and Human Services. So this group on the Monterey Peninsula, with their unhindered, which means that you can access $1.5 billion in cash and investments, is fucking around now as retaliation on my online account. Health and Human Services said, yeah, well, this could be used if you came in before, you came in before, like say your mammogram once a year, and you go in 390 days, 400 days after. So they know that you're way past the 1 year mark of 365 days. But they're still presenting a form that they're not supposed to present, because it's only supposed to be presented to the person if, say, you have to come in before that time frame. Like, say they find a lump and the doctor wants you to go in for another mammogram, but it's before 365 days. Then you present the form, and based on the doctor's code that we found a lump, I'm sending them in for a mammogram. And then you present that form, but is covered probably, more than likely, by the insurance. So every time Montage has presented that form to me, I have exceeded the time frame where Medicare would cover it. What does that mean? Well, if you can go in once a year, which is 365 days, and you're going in 390 or 400 days later, you have exceeded 365 days. Medicare covers it. You are not supposed to give me that form. My A1C for my diabetes is only covered every 90 days. So the only time I take it is at my 6-month intervals with my endocrinologist. So 6 months is how many days? Say 30 times 6, that's 180 days, give or take. So why are you presenting me a form with a strikeout? You're not even supposed to use it. You're not even supposed to be presenting me with that form because I've exceeded the time frame where Medicare would cover it. This place, Community Hospital of the Monterey Peninsula, Montage Health, is giving a form that they're not supposed to be giving because I have exceeded the time frame where Medicare would actually require that form to be presented. And then they're putting strike-throughs, and that's only supposed to be used if there's no coverage. You're before a time frame, and it tells you on the notes that it's only supposed to be used if you expect to transfer the cost onto the beneficiary, the insured beneficiary. They are committing mass levels of fraud.